Everybody needs a Frank in their lives, especially me. All right. Well, this in-service will be recorded. Just a few housekeeping items. Please be mindful of your microphone. Want to make sure that everybody is muted.
Someone's still not muted. Let me see who it is.
Maria.
Alfredo.
Maria.
Guys, you got to mute yourselves, please. Thank you.
Yeah, I got a meeting.
That's Lyrian. All right. Okay, well, if I could have everyone's attention, please be mindful of your microphone. Make sure that it's on mute. Also, I'd like to welcome you today. This is our second in-service of the month, for the month. And we are really trying to promote not only your professional development, but also to ensure that as many case managers and peers as possible are fully aware of all of the services that are offered through the Ryan White program here in Miami-Dade County. So this is not a mandatory training, thus it is not billable to the Ryan White program. So we obviously truly appreciate your participation. With that being said, this training or this in-service is only 1 hour. We have someone who is not muted.
It looks like it's Ileana's office. I don't see a...
Okay.
Okay, she is now.
All right. So I'd like to welcome everyone. We will have 3 presenters today. We will have Borinquen Medical Centers presenting, Empower You, and Care Resource, as you can see on the agenda posted. I would like to remind our presenters that your presentation shouldn't be no longer than 15 minutes, and that will include questions and answers. So if you could please be mindful of your time as you present, I would appreciate it. So if someone is there to sort of help remind you, or if you want to put a timer on, that would be great. So with that being said, again, for those of you who are just joining us, please make sure you enter your name, your professional title, and the name of your organization in the chat. I will be keeping attendance and sharing that with the county just in case you ever need this information in terms of participation in trainings. You will have this available for you. Okay. So let's go ahead and get started. I'm Sandra Sergi. I'm a project manager here at Behavioral Science Research. I have my colleagues and my boss on the call today. So we are super excited to be here with you today. We're highly appreciative of your participation. And for our presenters, thank you so much for your cooperation and for your enthusiasm. And we are truly looking forward to hearing your presentations. So without further ado, I'd like to welcome Dr. Carrie Acosta and Rosemont Francis from Borinquen Medical Centers. I'm getting used to saying that. So welcome, and I will stop sharing so that you can go ahead and start with your presentation.
Good morning, thank you. Let me share presentation. Can you see it okay? My computer is lagging. There we go.
Yep.
Yeah? Okay, great.
Yes.
So I'm Dr. Carrie Acosta. I'm a psychologist. I'm the director of behavioral health here at Borinquen. Rose and I are going to be presenting today on substance use disorder services for the Ryan White patients, Part A and MAI. So basically, our outpatient center here at Borinquen, we do have a substance use disorder program. We offer OP and IOP. For the OP, the patients are just doing outpatient services. They will have 1 hour of individual supervision with a therapist per week, and we strongly encourage them to join our groups, which are all available via Zoom 5 days a week in English and in Spanish. So it's very flexible for them to join. And for patients who are more severe, we have the IOP, which is intensive outpatient. This requires 9 hours of services per week. They will do 8 hours of groups and 1 hour of individual therapy. our substance use counselors are going to be working on the treatment plan for the patients. And we always communicate with the referring agency to see what the recommendations are and to see how we can work together to better help the patient. As far as funding, we have Ryan White Part A and the MAI. Locations, we're located in Wynwood at the 3000 Biscayne building and also 2691 Northeast 2nd Avenue. They're 5 blocks apart from each other here in Wynwood. We also offer everything via telehealth. So if there's an issue that a patient can't come here physically, that's not a problem for therapy. We can do everything online. Our referral sources are the medical case managers from external Ryan White providers. And our contact person, if you do have someone you are referring, is Stephanie Stonestreet. She's the manager of outreach, and she can be reached at the extension 711 or 1251 here at Borinquen. And her email is also on the screen as stonestreet@borinqenhealth.org. All right, Rose, you want to take over for the case management piece?
Good morning, everyone. My name is Rosalind Francis. I am the Y&Y Case Manager Coordinator. I'm actually introducing Stephanie Stonestreet to you, and she will go over slide 2 and 3. She's the one receiving all the referrals from external sources.
Hi, good morning. My name is Stephanie Stonestreet. I'm the outreach manager here at Borinquen. Initially, the referrals are sent from outside medical case managers and also like our internal medical case managers. My department is the one to approve these referrals. So what we're doing is we're verifying that the client is eligible, of course, that there's a referral and also their eligibility is up to date. So I will go ahead and do an Athena registration for these clients, and we will upload the case policy into our Athena, our EHR system. And then I am emailing over the referrals to our behavioral health clinical managers, and they are calling the patients to schedule these appointments. So they're receiving the referral, they will have it with them. The case policy is added, and then they are calling the patients to schedule these appointments. Okay. Of course, if they're not eligible, other funding sources can be used if the patient agrees, like our sliding scale fee. If patient declines services, even if there's a referral, services will not be initiated. It all depends on what the client wants. If the client does not answer the phone when we call, we leave a voicemail, or the clinical manager is leaving a voice message, and then also following up sometime later on to try to reach that patient again. Okay. It's very important that we have a medical case manager contact for each referring organization, so that if there's a referral issue, we're able to, myself will be able to call that organization and say, hey, like, we need this referral's about to expire, or the referral is not correct, so on and so forth. I know that on the end of it does give number, but sometimes what we call those phone numbers, they don't directly go to any, like, to a specific case manager. It just goes to the organization, then I'm transferred, and then I'm not able to reach somebody sometimes. So it would be important to have a direct contact the medical care department to handle those situations. And sometimes clients, when they come in, they're like, oh, I need a referral, but I can't reach my case manager. I don't know who else to call. So that would be a good place where we'll be like, okay, well, I have a contact. Let me go ahead and try to get somebody for you, right? I'm done with this slide. Go to the next one. Thank you. Okay, so the appointments, like we said, are scheduled by the clinical managers for behavioral health. If there is a referral issue, there is assistance with a referral, then you would give me a call at 7111, or somebody else from my team that also has access to provide and can assist with referrals is at 1251. And then to schedule an appointment, the clients can call those extensions that are listed there, the Borinquen number, and then there's multiple extensions. So if they can't reach somebody at one extension, they have a bunch of different options. And somebody there will be able to help them. The for eligibility, of course, their assessments are done yearly, and the referrals are only good for every 6 months. If the referral expiration date doesn't expire till, for example, August, but their assessment is due in June, that eligibility is only good till June. So that's something that we keep in mind when we're adding our case policy into our EHR system. If there's a no-show, then the clinical managers or I can always go ahead and contact the MCM, letting them know like, hey, we scheduled an appointment, but the patient didn't show up. So that we can get your assistance to reach out to those patients if we need that, of course. As an agency, we're able to do that on our own, but if we do need that assistance from an MCM, then we would contact them. And then, of course, clear communication is a big thing that we have to work on in order for us to be able to link and coordinate these patients' care, and just, of course, ongoing collaboration. And okay, this slide is done. Does anybody have any questions? Or Dr. Costa or I?
No questions? Okay. Well, thank you
Hi.
very
I
much.
see a
That was.
couple.
Carlos is raising his
Oh,
Carlos. Yep.
hand.
oh, okay.
Hi,
Thank you.
I'm Carlos Gutierrez from AHF. I just would like to ask if, as part of that IOP or OP that you give, if there's peer specialist support, and if we like to give them information of like into meetings for AA, NA, and take them or anything like that.
So we don't have any peer specialists, but the therapists do provide those resources. So we do recommend that they attend NA and AA outside of Borinquen, and we link them to those services in the community through the therapist.
Thank you.
Any questions on the referral process?
One question: you guys need a order from PCP or anything like that, or substance abuse, or in order to approve that?
So the diagnosis on the form, if I'm not mistaken, and Rose can correct me on this if I'm wrong, does need to be HIV related. So it would have to, we don't need specifically the referral from the primary care physician. But when the referral is being completed, the diagnosis does need to be placed there to make sure that it is covered by Ryan White. Rosemont, if I said something wrong.
Everybody that have the allowable condition list are on the call. I don't think you normally need a diagnosis for substance use. You don't.
That's what I
I think you're
was gonna
thinking about
ask.
mental health. You're thinking about mental health services. Since we're
Psychiatry,
talking about
yeah.
behavioral
Okay,
health.
so yeah, so this is outpatient, so we don't need the referral from the primary care physician.
But let me ask, the description for that service will just be identified possibly through the case manager's health assessment? When you're submitting that referral, you have to fill out something in that description. What would you guys like that to say? How should it read in the description? Since there's no diagnosis for that, I mean, unless the client has a self-diagnosis that, there's a substance use disorder or something like that, what would you like that description to say?
When I'm reviewing the referrals, mostly what we're verifying for specifically substance abuse, is that their eligibility for Ryan White is up to date, and the referral, of course, is up to date, and for us to be able to approve it. I mean, anything in there that could say, substance abuse related disorder, or for that, it doesn't matter because it doesn't require a specific diagnosis
Okay.
like from the allowable condition. So Rose was able to clear up that, but that one, it doesn't require anything specific. If they want to put in there, like maybe possibly if the substance use is alcohol or drug related, they can always add that in there so that the therapist can see that. Also, the clinical manager can see that when they receive the referral.
Okay.
Does Borinquen require maybe like a discharge plan or a care plan for a client who's coming out of residential?
We don't require it. If they bring it, that's fine. A lot of times we end up communicating directly with wherever they're coming from to get information and continue working with them, but it's not a requirement.
Okay. Great. Any other questions? No hands up? All right. Well, thank you so very much. Very helpful. This meeting will be online on aidsnet.org. For any case manager who is not present or peer is not present today, you will be able to view these trainings and in-services online afterwards. So thank you very much. Do we have Carrie on the call from Care Resource?
Yes. Good morning, everyone.
Hi, how are you, Carrie? Nice to meet you.
Good. How are you, Sandra? Nice to meet
Great,
you as
thank
well.
you. Thank you. So the
mhm.
floor is yours. Welcome.
Thank you. My name is Carrie Baumgartner. I'm the Behavioral Health Services Manager for the Miami-Dade locations of Care Resource. And let me share my screen. Okay, is everybody able to see my screen? Great.
Yeah. Thank you.
Okay. All right. Oops. All right, so our available behavioral health services and eligibility criteria. So our services that we have is our individual therapy, medicated assisted treatment. We have group therapy, peer services. Our services are offered both in person and via telehealth. And our outpatient substance use services are offered at all the locations. And I'll go into a little bit of our locations a little bit later with the contact information. But we have a location in Midtown, Little Havana, and in Miami Beach. The eligibility is having, pardon me, is just having an active Ryan White program, being an active Ryan White program recipient, and having that active referral for Ryan White Part A substance use services. Those are the only eligibility criteria that we have. Our referral process, I know it looks like a lot of information. It's actually quite simple. The Ryan White Substance Use Part A referral is entered into the Provide enterprise and approved by me if it's outside of Care Resource. If it's one of our MCMs, then it is approved by Edgar Mojica, the medical case manager. So if it's outside of Care Resource, I will approve it. But if it's inside Care Resource, Edgar approves it. So if it's the first time receiving services at Care Resource, we're going to register via our careresource.org link and click pre-register and fill out the form. And the website can be translated into Spanish and Creole. And I'm going to demonstrate that for you right now. I'm going to stop sharing and then share again. Okay. All right, is everyone seeing my screen now? Okay, perfect. So when someone comes in and they are a new client to Care Resource, they're going to click right here, pre-register. So right here on the side. But also you can see here where you can toggle into Creole and also Spanish. And then the website will change according to your language preference. Okay. So if I go into this pre-registration tab I click a different language here, you'll see that it comes up in Creole. You'll see that it can come up here in Spanish as well. And then this form is filled out as a pre-registration. Okay. And let me go back to the slides.
Harry, someone should register after the referral has been approved, correct?
They can
Or
register they
at
can
any time.
register, yes, at any time. And then it's great then to have that referral because we need the referral in order for services to start.
Mhm.
Okay, 1 second here. Okay. All right. So if you don't want to register online or have barriers to internet services, it's also on your phone and we have the mobile website. So, but if you have internet services barriers, you can walk into a care resource location and register in person. And of course, those documents are also available in Spanish and Creole. Once the registration process is complete, the individual will receive a call from a client support assistant within 1 to 2 business days to schedule a 2-hour intake appointment with a therapist. So that's once the registration is complete. So there has to be time for that, the completion of the registration process. So what happens is that pre-registration is done and then the registration specialist will reach out to the client to complete the rest of the registration. And then our CSAs, our client support assistants, will contact the client to schedule the appointment with the therapist. If you're a current or a previous or current recipient of Care Resource Services, you're already in our system, so there's no need to register again. You're already in the system. We'll just need that referral. There we go. Service limitations or special considerations. Our telehealth services are available to assist with transportation barriers. And our no-show policy is upon 3 consecutive no-shows to appointments with the therapist, the services will be provided on a walk-in basis, meaning that the client will have to wait until the therapist is available. And then once they do the walk-in appointment, then appointment scheduling will reoccur after that. The client will then be able to schedule for services after that. A Part A substance use referral should remain current to limit disruptions in service. And these are our locations. So we have Midtown right here on Biscayne Boulevard. I can almost see Brinkman. So not that far away. Then we have our little Havana location. It's at 1800 Southwest 1st Street. Our Miami Beach location, 1680 Michigan Avenue. Here is my information and then our behavioral health front desk contact info. We're cross-trained in both counties, so both counties answer the phone, and our CSAs are Gabby, Claudia, Rigoberto, and Oriana, and that is our extension to our front desk. Okay. Any questions?
Yes, I do have a question. I was trying to read the whole one of the slides and I missed it. You guys, I believe, provide support group in person care resources.
Yes, we do provide support groups in person. Our support groups are getting up and running as of July 30th. We will have an HIV group that is open both male and female, and non-binary, anyone on the gender spectrum. And it will be 18 and older. And
Do they
that'll
need to
be in person. And
Okay,
that's of
yes,
July 30th. We had taken a
And do
break
they-
from it. Mhm.
Do they need to register and on your website prior to attending, or they just I think email the person who is the facilitator? How that will work?
Yes, so they need to register for all services, so they can be put into our electronic health record. After that, any person that is attending group will need to have an intake completed, a therapy intake. So the first thing that they would do is schedule that therapy intake and then be placed into group. So it would be registration, then the therapy intake, and then group.
Thank you.
You're welcome.
One question.
Sure.
For patients that are from other agencies to go to those support groups, the HIV and everything, as you were saying that they need a therapy session first, we would need to refer them to you for mental health
Yes,
so they can
you would,
have that appointment and then they can get to the to get to the groups.
right. So absolutely. At this point in time, because we are not a Ryan White Part B funding for, we're not a Ryan White Part B funding site. We're just Ryan White Part A substance use. So it would just have to be a Ryan White Part A substance use referral, because we are not able to, we're not a site for Ryan White Part B funding. It's just Ryan White Part A substance use. So those would be the referrals that we would be accepting.
So Carrie,
Is that-
the groups that Edmond was just talking about,
Yes.
are those specific to outpatient substance use?
It is, one is,
As of July 30th?
as of July 30th, there's going to be one that's HIV. We'll have other ones coming up that are going to be specific to substance use. Yeah.
But
So-
that group doesn't need a substance use referral.
That group, the HIV does not need a substance use referral. However, we
Okay.
wouldn't be able to accept services under Ryan White. They would have to be on a sliding fee scale, because
So
we
there's
don't
a
accept Ryan
fee.
White Part
Oh,
B.
There's a
Mhm.
fee for
oh,
that.
there's a fee for
There's a
attending
fee.
a group.
There's a
Oh,
fee
I
for
see.
attending, there's a fee for attending the group, the Ryan
The
White
HIV.
Part, yeah, the Ryan White Part B, which would be our mental health. There would be a fee for that, because we're not a Ryan White Part B site. We're just a substance use referral site.
Interesting.
And does Care Resource offer mental health services? Would a referral for mental health be appropriate to attend that
Yes.
group?
Yes, we do offer mental health services. It's just that we don't offer Ryan White Part B mental health services.
Correct.
Right.
Correct.
So then the client would have to, they would be on a sliding fee scale instead of their Ryan White, instead of it being covered by their Ryan White.
So those groups are funded by Part B. That HIV group will be funded by Part B.
No,
Is that what you're saying?
No, the HIV group will be funded by Part A. So it's a support group, but there will be substance use in it. And then we also have clients who are not Ryan White, who have insurance and will be under.
Oh, I see. Oh,
Yeah.
okay. Okay.
Yeah.
Understood. Thank you.
Any other
I have-
questions?
I do. I have a question.
Yes.
Would the person, I guess on the substance use side, I'm not sure if it would be substance use or the mental health side, would they collaborate with the case manager as it relates to clients that kept those appointments? Because you did mention if there's 3 consecutive no-shows, and sometimes it's a self-report if the case manager interacts with the client and they says, yes, I went, when they actually didn't go.
Mhm.
So could the case manager contact someone at your agency to verify those kept appointments? Because I'm sure if they're participating in an outpatient substance use, I don't know what your time frame would be. It would need to be included in their care plan. So they would want to update the care plan as the client, completes those sessions. So would that be a possibility?
Absolutely. Our front desk can be notified. I can be contacted, and I can let you know who the therapist is and what their email address is, to get in contact with them to have that communication back and forth, that open communication regarding the client's attendance.
And there has to be a consent form signed by the client for that, though, right?
Yes.
Do we have any other questions for Carrie? No hands up?
Thank you very
All
much,
right.
everyone.
Well, thank you so much, Carrie. We appreciate it. And it's a pleasure meeting you. And hopefully this will sort of provide some additional, clients for you guys. I'm sure the services are much needed. So thank you. All right. Awesome. We're doing great on time. Empower You is here with us. Lyrian, how are you? Can't hear you, honey.
Oh, you're muted, Lyrian.
You're muted. Unmute her.
Can
I'm
you do
here.
it? Oh, there she
There
goes.
you go.
This is my first, so bear with me.
No worries.
Okay. Hold on, let me see how I share this thing.
You got this.
Shoot. Okay. Miss Sandra.
Yes. You want me to share it for you?
Please, ma'am.
No worries. Give me 1 second. All right. Okay.
Thank you much.
You're welcome.
I'm Lyrian Oquendo. I'm the medical case manager for Empower You, which is a community health center. We are a federally qualified health center. We run an outpatient substance abuse group, but it's a support group. It's not a group that's affiliated with Ryan White Part A, Part B. It's a support group that helps individuals, that our goal is to prepare an individual physically, because if they come in here for the group, they can get medical care, they can get behavioral health. It all stems from their willingness to make a change in their lives. A positive change. So I know I put this on here, but I'm a recovering addict myself, so I kind of like do it differently. I've been clean for 35 years, so I think I have something to offer them. And another part of our group, we have different facilitators that are HIV positive and been clean from drugs. So our goal is to fully prepare an individual client physically, which means medical, and mentally, which is the behavior health, so he or she is able to participate in the therapeutic process of one addict helping another to reach a goal, staying clean and sober. The client is looking to make positive changes in their lives. We provide the steps and the strategies to help them build themselves up mentally, spiritually, and emotionally. I'm going to elaborate on that a little bit, because coming off of the streets, we come up, toe up from the floor up, and we need somebody to support us, and that has been on that road before. And that is what our purpose is. And this is some of the types of addictions that we talk about in the group. We have people that's addicted to nicotine, alcohol, over-the-counter drugs, food, caffeine. We have workaholics. We have shopaholics, social media. That's the legal addictions. The illegal addictions is the marijuana, the cocaine, and the crack cocaine, amongst other dependent drugs, sex, opioids, gambling, scratch off tickets. And a lot of times they come in here, especially with the gambling, they don't know it's addiction because all they do is buy one scratch off ticket. And before they know it, they spending plenty of money on scratch off tickets and they have nothing to eat. So, we help them through those barriers. And our group meets 4 times a week. We meet from a Monday through Thursday from 10 a.m. to 12 a.m. And the group is ran as if they would go to a NA or AA room, because we do read the literatures from recovery, which is who's an addict, because they need to know who they are. Why are they here? They need to know why they are here and how it's going to work for them. And these are the things that help me get where I'm at. And the topics we also read from Just for Today, which is a meditation reading, and Each Day a New Beginning. It's a women devotional, but we take it and we connect it with at all, because it's not just about women, it's about men. No matter who it is, if you have an addiction, it's an addiction, no matter who you are. And I'm the person that you can call and get into the meetings. We don't do referrals. We used to, but I don't know what happened. I'm new at this. But if you feel like you have an issue, problem, or situation going on, you come in here and we give you your support. This is why this is a support group, not an outpatient treatment or therapy. It's a support group to help you get where you need to go. It's like a stepping stone for recovery, no matter what the addiction might be. Because a lot of times we have addiction and we don't even know we have it. And that's my presentation.
Great job, Lyrian. Thank you.
Thank you, Miss Sandra. I'm nervous,
did
right?
So well. No, you did amazing. Thank you.
Any questions?
I think Edman has a question.
Hi, once again, on the support group that you're mentioning, is there a difference, or do they have a different group for? I know all are addicts and they are, across the board, no matter who you are and everything. But I know some people prefer to be in a group only for, gay or, females separately. Do you guys provide that, or you just co-ed group?
This is a co-ed. This is a non-judgmental group. This is a co-ed. It doesn't matter what road you came down. The only thing that matters is you want some help to get to the next level.
Little heart. Thank you. Do we have any other questions for Lyrian? No? Okay. Well, thank you so much, everyone.
Thank y'all for listening.
For being here today. There will be 2 additional in-services during the month of July, and hopefully we'll be planning more in-services. As I mentioned, this is not billable to the Ryan White program. So again, we do appreciate your participation, and hopefully this will help you as you continue to work with clients and ultimately enhance their experiences within the program. So thank you so much for being here today, and if you guys have any questions in the future, just, feel free to let me know.
Sandra, I just want to say one thing before we go off.
Sure, of course.
Everyone is welcome to our group. It doesn't matter. Everyone, whether they coming out of a treatment facility, no matter what, everyone is welcome to our group.
Thank you, Larian.
Awesome. I think we have a couple of hands raised.
Yeah,
We have
couple of
Samantha
hands.
first and then Carlos.
Thank you.
Hi, everyone. My question is directed to our leader, Sandra, and those. Will we be able to have an updated telephone direct booklet like we had before with the agencies and what all they what they're servicing and the people we need to contact for certain things like for care resource, not care resource, I'm sorry, the one that presented earlier, and Miss Lillian, like their names listed like for outpatient therapy, like how we
Sure.
had before. Can we get an updated contact list?
I can't create one like Carla used to or the county used to, but what I could do is create a contact list for each of these trainings and sort of develop.
Yeah.
We just finished developing an oral health care referral contact list, so that's a great idea, Samantha. I can put together something that will represent each of the in-services that we have, and I can put it like in one document. We can also create that list and put it on AIDSnet. There's the new case management hub. You guys should really check it out because it has a new feature with the calendar that you can click on the days and see everything all the services that were provided. And then we can also add documents. So Samantha, great idea. I'll put that together. And see if we can just publish. Maybe what I'll do is at the end of every month, depending on how the trainings go, I'll just create one resource and then send it out to everybody.
I mean, it would help you guys eliminate some emails,
Sure. Yes.
it
No,
was
that's a
just
great
thought.
idea.
Thank you.
A contact list. Thank you. There was another question, wasn't there, on the?
It was the same question.
Okay. Bob, you have a
Yeah, I was just
question?
going to add to this a couple things. First off is the case management portal that we have on aidsnet.org basically includes a link to the video to these individual in-service trainings, so you can review it. You can also see who all is on it. But a bunch of years ago, the county got out of the habit of doing the paper copy contact list, and people have been asking for that for about a year and a half now. Okay. And I think that basically Sandra's idea is to create an ongoing updatable contact resource on AIDSnet that you can download and look at, and that periodically we can ask people who are part of these sessions to look at the way their own agency is represented on these lists and make any corrections periodically that are appropriate. Because, as the referral process gets complicated and as people find that calling a central, there we go. Okay. As people find that calling a central telephone number is less and less useful, the more complicated agencies get. Such an articulate list is something that we can help provide for you as a resource, as a way of improving services for your clients and referring to one another. So Christina and I are looking at what we can do already to improve the training portal, for example, to make sure that not just this training, but future trainings are recorded and made available through aidsnet.org, through the service provider hub, to make that available to everybody who's on the call.
This is our website, aidsnet.org, and as you can see here on the hub, if I go If I just scroll down, for example, we have upcoming trainings, but then here.
I don't see you scrolling, Sandra.
Can you scroll, Sandra?
I am scrolling. You don't see me scrolling?
No, ma'am.
That's so interesting.
Maybe try to reshare. Seems like it's frozen. Let me try to share. Hold on. Oops, wrong screen, but it doesn't matter. Here we go. Can you guys see? Perfect. So we scroll down. Right here is our recordings. Is that what you wanted to show, Sandra?
Her mic, everything's frozen. Is that what you wanted? You can't see anything? Scroll down to the calendar, Frank, and then click on the 9th, and they can see the trainings.
Yep. So you can see how that training was held on the 9th.
Right.
And today's the 16th. And obviously this is what we just had.
Right.
So this will be our calendar of events. Okay, so our next one is on the 23rd, right? Which is food bank and legal services?
Correct.
Okay. Yep. And it seems like Sandra's computer has given up for
Come over and
this
say goodbye.
training.
She's
Give me
gonna
one
come
sec.
over and
She'll
say
probably
goodbye.
she'll come over here, guys.
Come on. No, come on. She's gonna come and say goodbye.
All right, well, can you guys hear me? Can you hear me?
Yes.
Okay,
Yes.
anyway. Okay, great. So anyway, thank you for being here. We do have 2 more trainings. I'll be sending out reminders to everybody in case there are additional staff that would like to attend. You can, supervisors on the call can forward the links to your team as well. So we will be in touch. I'll be sending out to our presenters a list of all of the case managers and supervisors in the program, so you have a resource. I will also, as I mentioned, reconfirm with everyone to make sure that I've captured everybody in attendance in case, I miss somebody. And this video should be online, if not by the end of the day, most likely tomorrow, depending on Christina's schedule. So once again, thanks for being here. It's always great seeing you. I'm excited about, upcoming trainings, and hopefully you're finding this helpful in some way. So have a wonderful day, and I will see you guys soon.
Thank you very much.
And make sure everybody logs off of the